any type of arthritis and for their families and friends. It provides basic information about fatigue as well as tips on how to manage it. What is fatigue? Fatigue is the feeling of extreme tiredness or exhaustion, often involving muscle weakness that can result in difficulty performing tasks. It has been compared to the tired and achy feeling one has when experiencing a bout with the flu. Fatigue is a frequent and troubling symptom of many types of arthritis and other rheumatic diseases such as lupus. It may be due to many causes such as illness, depression, joint and muscle pain, stress, overextending yourself, poor sleep, anemia, or a lack of physical activity. The symptoms of fatigue vary from person to person. They may last a long time or only a short time. They may strike at any time or may be predictable. There are many things you can do to help decrease the effects of fatigue. Knowing how it affects you will help you manage it better. Fatigue and arthritis. Fatigue is problematic especially for those people with chronic conditions like arthritis. If fatigue is of new onset, is getting significantly worse, or interferes with activities of daily living, it would be valuable to see a health provider. There are many causes of fatigue, and a physician or nurse practitioner will be able to help diagnose and treat the causes of your fatigue. How does fatigue make you feel? Fatigue affects everyone differently. For instance, it may make you feel very tired with no energy. All you want to do is sleep. Some people who experience fatigue associated with their arthritis or lupus say, "When I'm fatigued, everything is too great an effort. Everyday tasks become too much to do." Increased pain. Fatigue often comes along with pain. One person with arthritis said, "Pain itself is very fatiguing. When I'm tired, I can't cope as well with the pain." A loss of control. Sometimes fatigue may make you feel helpless. You may feel you have little control over life. A loss of concentration. Decisions become more difficult. It's as if your mind is tired too. Irritable. It may be difficult to be pleasant or happy when you're constantly tired. This may put a strain on your relationships. One person with arthritis commented, "I'm grouchy when I'm fatigued and I just don't care." Fatigue may be accompanied by pain, irritability, and/or loss of energy, concentration, or sense of control. Causes. Factors causing fatigue. There are many causes of fatigue. Some of the reasons people get fatigued are because of arthritis or another chronic condition: depression, anemia, thyroid problems, nutritional problems, lack of adequate sleep, or deconditioning. Treating these conditions often leads to a reduction or elimination of fatigue. Causes differ from person to person. Fatigue may be caused by one factor or it may be caused by several factors. Physical causes. Disease. Fatigue may occur with many types of arthritis and other rheumatic diseases, especially those that affect the whole body, muscles, skin, blood, organs, as well as joints. These include rheumatoid arthritis, which can cause joint pain and swelling, lupus, which can cause a skin rash, joint pain and problems with other organs, and fibromyalgia, which can cause extreme muscle aches and pain. The process of inflammation can cause pain and swelling and also may cause fatigue. If you experience a flare or period of worsening joint inflammation, you're likely to become more fatigued. Pain. If you have joint pain, you may use body positions that are less painful to your joints. However, these positions can put extra stress on your joints and muscles. This can lead to fatigue. The physical and emotional energy you use trying to deal with pain can make you feel fatigued. Pain also may lead to fatigue by causing you to lose sleep or preventing you from really sleeping well. Anemia. Several types of arthritis may be associated with anemia. This is a problem in the blood. It is a decrease of a key ingredient in your body's energy cycle. Anemia makes you feel tired. It cannot be corrected just by taking iron pills. Being less active. You may not feel like doing much if you're in pain, feeling depressed, or if every task is a major effort. When you feel this way, for example, you may do less work around your house or yard. But if you don't get enough physical activity, your muscles will get weaker and feel tired most of the time. Other health problems. Health problems of the heart, lung, and thyroid also may make you feel very tired. Emotional causes. Living with any type of arthritis day after day can be emotionally draining. The following types of emotional stress can lead to fatigue. Depression. The stress of an illness may make you feel sad or blue. You don't feel like doing anything, going anywhere, or being with friends and family. These feelings can make you feel tired. Being tired all the time in turn can contribute to depression. It's a cycle that at times can be difficult to escape. Overextending yourself. Most of my fatigue comes from overdoing, some people say. After all my years of living with arthritis, I still find it hard to pace myself. The fatigue is always there in varying degrees. Sometimes it is difficult to know when I've reached my limit. I don't always listen to the signals of pain and fatigue. When I feel good, I push myself too hard. Do you feel the same way? If you answer, yes, this may be one cause of your fatigue. It's natural to want to keep up with your regular activities. But with your arthritis, this may not always be possible. Trying to hide your illness from others. Some people don't want others to know they have arthritis. They push themselves to do the same things, at the same pace, that people without arthritis do. This usually results in having to pay for it later. Environmental causes. Features of the environment, your surroundings, may add to your fatigue. Loud noises and warmer temperatures may be tiring. For the person with arthritis, uncomfortable furniture, lots of stairs and long waits may be very tiring. Identifying causes. Think back to the last time you were fatigued. In the following list, note the things you think add to your fatigue. Arthritis, flare, depression, pain, anemia, muscle weakness, not enough exercise or activity, emotional stress, not eating properly, not enough sleep, lack of quality sleep, overdoing daily tasks, holidays. Managing fatigue. Analyze your fatigue. Because there are many causes of fatigue, you may need to use more than one method to manage it. What adds to your fatigue? At what time of day does your fatigue start? What helps decrease your fatigue? Listen to your body's signals telling you it needs to rest. Learn to pace yourself so you won't become too tired. Analyze your fatigue. Because there are many causes of fatigue, you may need to use more than one method to manage it. What adds to your fatigue? At what time of day does your fatigue start? What helps decrease your fatigue? Listen to your body's signals telling you it needs to rest. Learn to pace yourself so you won't become too tired. Be aware of body positions. Change the way you do activities so that you don't put too much stress on your joints. Maintain good posture. Poor posture, slouching, can stress your muscles and lead to fatigue. Balance rest and activity. Learn your body's signs of getting tired. Take breaks during or between tasks before you get too tired. Pace yourself during the day. Do a heavy task, then a light task, then another heavy task, and so on. Do the most difficult things when you're feeling your best. If you pace yourself, you probably can work more than if you work straight through until you're worn out. When your disease is more active, take longer and more frequent rest breaks. Pace yourself from day to day. Allow plenty of time to finish the things you start so you won't feel rushed. Don't try to do too much at one time. Make your work easier. Learn your body's signs of getting tired. Take breaks during or between tasks before you get too tired. Pace yourself during the day. Do a heavy task, then a light task, then another heavy task, and so on. Do the most difficult things when you're feeling your best. If you pace yourself, you probably can work more than if you work straight through until you're worn out. When your disease is more active, take longer and more frequent rest breaks. Pace yourself from day to day. Allow plenty of time to finish the things you start so you won't feel rushed. Don't try to do too much at one time. Make your work easier. Plan ahead. Look at all the tasks you do both at home and at work during a normal day and week. Eliminate the ones that are not necessary. Delegate some of the others. Make a schedule for each day, the night before or in the morning. Think about what each task involves in terms of the amount of time it requires and how tiring it is. Make an action plan with this in mind. Schedule rest breaks before you begin. Combine chores and errands so you can get more done with less effort. Create shortcuts. For example, you can save time and energy by preparing several meals in advance. If you want to serve more complex meals, choose a day when you have more time and are feeling well. Sit when you work if you can. If you can't, take short rest breaks as often as possible. Practice relaxation techniques at your desk. Use labor-saving devices such as an electric garage door opener, a microwave oven, or a food processor. Use self-help devices such as tools with enlarged handles, jar openers, or reachers, long-handled devices that help you reach high places. These reduce stress on your joints and can make difficult tasks easier. Organize work areas so you can get more done with less energy. Arrange your desk or workspace using inexpensive storage bins. Remove unnecessary items from your briefcase to lighten the load between home and work. Keep equipment needed for a particular task together in one area. As a general rule, keep items you use most often nearest to your work area and less used items further away. If you are writing a report, assemble all the information needed before you begin. If you are baking, store mixing bowls, sifter, measuring cups and spoons in one place. If you are doing housework, keep cleaning supplies in several places, kitchen and bathroom, upstairs and downstairs.